Welcome to the Plain English Public Health Weekly Report. I'm Richard Greenland, and today is January 15th, 2021. As always, we start with our COVID-19 statistics. Worldwide, we have over 94 million cases and over 2 million deaths. In the United States, we have over 24 million cases and over 400,000 deaths. Just this past week, the United States has averaged almost 4,000 deaths a day from COVID-19, with some days even reaching close to 4,500 deaths. This week, scientists found new COVID-19 variants in Japan, Brazil, and the United States. Those variants all have similarities to the B.1.1.7 variant, but it's too early to know right now how dangerous they'll really be. It may end up that they're just simple variants that don't really make much difference, or it could end up being something really dangerous. We just don't know. Hopefully we'll know more by maybe next week or the week after, once they've been able to do some more research. Dr. Fauci this week said that the South Africa variant, the 501v2, could prove to be problematic for antibody drugs. It seems to be able to skirt the protections offered by those drugs to like the original variants and the ones that we've already been seeing. In vaccine news this week, Johnson & Johnson has stated that early results from the trials show a strong antibody response even with just a single dose. They expect to have full results of their phase 3 trial by the end of this month or possibly into the beginning of next month. If all goes well, they could gain FDA approval by mid to late February. So that'll add another vaccine to our arsenal to fight against COVID-19. So that's definitely good news. Some other good news is that the Johnson & Johnson vaccine is a bit different from the current vaccines we have. Our current vaccines focus on the spike protein. The Johnson & Johnson vaccine is delivered a little differently. It uses a weakened version of a common cold virus to deliver genetic material from the COVID-19 virus, and it does not focus on the spike protein. So that could help with variants that have mutations in the spike protein, such as the 501v2 variant. We'll have to see, like I said, about a month or so from now, we'll probably be able to have that out and people will start receiving that. So hopefully all goes well with the trials and we can get that going. It's now been over a year since COVID-19 appeared in the United States, and it's been almost that long since the CDC started recommending face masks. In the United States, we're doing better. We're doing better generally at wearing face masks. Even 2 months ago, we had a lot less face mask wearing than we do now. We can still improve, however. I keep saying it on these reports. Public health officials throughout the U.S. and the world keep saying it. We do need to get better at wearing face masks. Another thing about masks that needs to improve is the type of masks that we're using. Quite a few studies have been done that show different levels of effectiveness with different types of masks. You've got your neck gaiters, bandanas, your cloth masks, including the homemade cloth masks. They do work, but they're just not as effective as, say, the N95 masks or the surgical masks. There are also newer masks that are available now that have, they look like cloth masks, but they actually have a filter layer in the middle that is just as good as surgical masks filtering, and in some cases, just as good or even slightly better than N95 mask filtering. So some of those newer masks are really good. They've been vetted by medical laboratories and everything that are doing all the testing. And so, some of those are better than anything else we've got out there. That's great that we can take something so negative as a pandemic and use it to get something so positive as, new filters, new ways of doing things, new ways to protect ourselves. So that's a great thing that comes from such a bad thing. At this point in the pandemic, we really should not be using the neck gaiters, the bandanas, the regular cloth masks. Those were never meant to be a permanent fix. They were always supposed to be a stopgap measure until we were able to get the actual good masks at a point in production that everyone would be able to get it. N95 masks are still pretty limited. We just don't have the resources because there are so many cases that the hospitalizations have gone up, and there's just so much more work for all the healthcare workers. And so those N95 masks are really needed. Other than that, though, we've got those surgical masks we've got tons of those. You go into any store, Walmart, Target, your local grocery store, any place at all, and you'll see, a display with tons of masks. They're sold in boxes of 50 or 100 or 25 or whatever. We got tons of surgical masks. The other masks that I mentioned, the newer masks that have the filter inside the layers of cloth, those are also readily available. You'll see advertisements for those on your social media as you're going online, just going through the websites. You'll see the ads off to the side. So they're everywhere. They're readily available, and so you're able to get those too. They're a bit more expensive, but they're also better. So what's best? My recommendation is that if you are out and about in public a lot, you're going to be, if you're using a surgical mask, you're going to be replacing it fairly often anyways, because as soon as it gets moist on the inside, it's much less effective, so you're going to have to replace it anyways. So if you're doing that, if you work or have other reason to be out and about all the time, you're going to be much better off just getting yourself a good quality mask with a filter in it, and going with that. Even though those masks are often anywhere from $15 to $30 a piece, they're reusable, they're washable. Oftentimes they can be used for 50 days at a time, or even longer in some instances. So it's worth it if you're using, or if you're out and about a lot. It's worth it to go with the better mask. It's got better fit around your mouth, and so that'll help a lot too. If, on the other hand, you stay home most of the time, if you've got the money, you might as well go for the better mask anyways. But many of us during this pandemic are not the best off financially, and so if you want to save some money, the surgical masks are cheap. Typically you can get a box of 50 for $10. That's about 20 cents a mask. Sometimes you can find it for even cheaper than that. There are places that sell them for more expensive than that, but let's avoid those places so that they eventually are forced to reduce their prices to what it should be. But still, it's pretty cheap, especially if you're just using it every now and then. And so just buying a big box of surgical masks and putting them in your vehicle, or by the door so you can grab one on your way out, something along those lines would be perfect for people that just don't go out very often. So some of you may be wondering, why are we talking about masks and changing masks specifically this late in the pandemic? Aren't all the vaccines coming out now? Aren't we going to be able to get rid of COVID-19 here just within a few months? Why do we change it up now? Well, there's a few reasons here. Yes, vaccines may go ahead and eliminate COVID-19 here fairly soon. We hope that's the case. We really do. And as of right now, we think that will happen. But we're also starting to see all these new variants come out, so we don't know for sure. It's possible that some variant may come out that skirts the vaccines completely. All the vaccines that we have won't be effective against it, possibly. We don't know. If that happens, we're going to have to keep up with all the guidelines of mask wearing, the social distancing, and the washing of hands, and everything else, avoiding crowds. So while we hope for the best case scenario, it's always better to plan for the worst outcomes. The things that we hope won't happen, but very possibly may. And so we do need to make sure that we have those masks available for us to use. Another reason that we should be changing up our masks and not relying on those net gaiters, bandanas, or the simple cloth masks is that between now and the time that the pandemic ends, the better protection everyone has, the more likely it is that the case numbers and deaths and hospitalizations will all go down. We can save lives by doing a better job at protecting ourselves and others right now. And then the last reason I'd like to give right now, there's plenty of more reasons, but the last one I'd like to focus on right now deals with a new study that the CDC has done. They were looking at flu, the flu virus. Last year, the 2019, technically, flu season, there were only about 65,000, there were about 65,000 cases between September and the end of December. So basically by about now, for the 2019-2020 flu season, there were about 65,000 cases. For the same time period, for the 2020-2021 flu season, we've got just barely over 1,000 flu cases. That's a huge drop. Now, some of you may think, well, maybe it's because we just haven't been testing for the flu because we're all testing for COVID-19. That's not the case. In fact, most of the time when someone goes in for a COVID-19 test, they actually take that sample that you give them, whether it's saliva or your mucus or whatever they grab, and they actually test it for multiple things because it's not just that they're looking for COVID-19, they're also trying to figure out why you're sick. And so they'll usually test for COVID-19, the common flu strains, and a couple other things, depending on the symptoms you report. And so we've been doing a ton of flu testing, probably more than last year. And so it's definitely not a lack of testing for the flu. So maybe it's that the flu got weaker. No, that's not the case, because those that have actually gotten the flu this year are reporting the same severity of symptoms as other people, as other years. So definitely the flu hasn't gotten weaker. Based on the CDC's research, the only reason that they can find, after eliminating all the things that don't make sense based on the data they have, is that the mitigation strategies that we're using, specifically wearing a mask, social distancing, avoiding crowds, and washing our hands, those are the only things that we're doing differently this year that would explain the reason for the huge drop in flu cases. Wearing a mask and doing all the other stuff is not just good for COVID-19. It works for pretty much any disease or illness of any type that spreads from person to person. So we need to keep wearing our masks. It's my hope that even after we've beat the pandemic, we'll still consider it culturally and socially acceptable to wear a mask in certain situations. Before the pandemic, if you saw someone wearing a mask and they weren't in, healthcare, like a doctor or nurse or something like that, you'd probably think they were weird or at least paranoid. Now, though, this is our new normal. We people typically wear masks. Wish we had more people wearing masks, but it's still pretty normal. So once we've completely beat this pandemic and we go back to a quote unquote normal life, I would hope that we would be considerate of others in using masks in certain situations anyways. For example, if we're feeling sick and we're not able to just stay at home, we should wear a mask. We should take a mask with us and wear it. If there's other situations, for example, during the flu season, we should be wearing a mask. Everyone should be wearing a mask during the flu season. And if that, other than that, as long as there's no pandemic, we should be able to go mask free pretty much any time. It's just during those specific times that we would need to wear that mask, but we should be able to do that without, feeling like we're going to be made fun of or anything like that. So keeping a good quality filtered mask, one of those newer ones, or a box of surgical masks on hand should be something that, is just second nature to us. We should get used to doing that. Continuing on, new research shows that gut bacteria play an important role in recovering from COVID-19. The study found that patients with COVID-19 had a much different gut microbiome than those who were not infected. It's not clear if COVID-19 is causing the gut bacteria to change, or if it's just that those with a healthy gut bacteria are less likely to get COVID-19 in the first place. Current research suggests that the good gut bacteria does exert a protective influence, but we just need more research to be absolutely certain about that. The researchers did create a probiotic formula that, when taken by patients, resulted in a quicker recovery than those patients that didn't take that formula. Taking that formula helped them to fully recover and not continue experiencing symptoms like with long haul COVID. So this is still early. The research has not yet been peer reviewed. And so we do need to get that done. We need to have more research into it to figure out the intricacies of what's going on here. But it does seem very promising. This would be amazing if we can fix COVID-19 or even prevent COVID-19 just by fixing our gut bacteria. Taking probiotics and things like that, if that fixes it. We'll see. We've talked about the gut microbiome briefly in previous reports, but it seems that it does affect many different aspects of our health. This is especially exciting for those of us in public health because we tend to focus more on preventing illness rather than fixing it after it's already happened. Those in the healthcare side of things, like doctors and nurses, they also do a lot of preventative stuff, but they also mostly focus on fixing it after it's gone bad. Public health completely on the preventative side as much as we possibly can, though it does overlap a little bit with the healthcare and fixing things afterwards. So more and more research is showing that eating healthy, exercising, doing things to encourage a healthy gut microbiome, those things make our overall health better and help us live longer and have a better quality of life while we're living. So on that note, I'd like to take a moment for a personal request. You may have noticed in these reports that I'm not in the absolute best physical shape. You can kind of tell here, even though you can't see me a whole lot, you can tell that I'm a little chunkier than I should be for my size, my height. My BMI, or body mass index, makes me technically obese. Now, this may come as a surprise to some people that doctors, nurses, public health professionals, others in healthcare, we're just as likely to be overweight or obese as anyone else. You'd think that with our knowledge of how things work, how to be healthy and all that, that we'd be shining examples of fitness. But we're not. It's not all about knowledge. It's actually a lot harder to actually do something about your health than it is to talk about it or learn about it. So that brings me to my personal request. At the beginning of this year, like many of you, I set a New Year's resolution. My resolution is to lose weight and to just generally become healthier. Now, I've made this resolution many years before. And I always seem to fail, come February or sometimes March or April, I'll get that far and then I go back. And so this year I decided I'd do something a little bit different. This year I'm hoping to be held accountable by more people than just my family. I'm hoping that, all of you that are watching will hold me accountable. In order to do that, I've actually created a separate channel. Using the knowledge I gained from doing this Plain English Public Health YouTube channel, I've created a different channel that is basically me putting updates and also sharing my knowledge of weight loss, nutrition, things like that, things that I know, but I just haven't been doing a good job of in the past. And so I'm hoping that I can not only get encouragement from you, but also motivate you and anyone else that needs it. In order for you to watch that that channel, I've gone ahead and put a link to that channel in the description below the video, and also right above my head right now there should be a link there that you can click. So I'd really appreciate it if you'd subscribe to that channel. Just a personal request. Do it as a favor to me. But anyways, thank you so much for your support. There is so much more that I would love to get to this week about public health. There's quite a few things that would be nice to talk about, but as usual, we just don't have time to go over everything. So, please, as always, go ahead and look at the links below the video to see what we didn't get to and to get more information on the stuff that we did talk about this week. So thank you for watching the Plain English Public Health Weekly Report for January 15th, 2021. I'm Richard Greenland, and you have a healthy weekend.